What is osteoarthritis, and what are a few of the treatment options that are available to patients who are suffering from this, such as arthroplasty? Hi, I'm Dr. Jeremiah Maupin. I'm a board-certified, fellowship-trained hip and knee reconstruction specialist, and I want to talk to you about some of that today and hopefully provide some information that will help you get back to more function and get back to a better quality of life. There's a few different types of arthritis. We have our inflammatory arthritis conditions such as rheumatoid arthritis, psoriatic arthritis, but the most common thing people experience is osteoarthritis, which is the wear and tear of a joint with time. It's the progressive loss of cartilage, which exposes the underlying bone, which has nerve endings, which when those come in contact with each other can generate pain. So arthroplasty means joint replacement, and most commonly this is being done on the hip and knee. Other joints can have arthroplasty, such as shoulders, elbows, even wrists, but the most common joints being replaced are the hips and the knees. A lot of orthopedic procedures are focused at repairing or reconstructing certain ligaments or tendons. When it comes to arthroplasty, we're just replacing the entire joint itself. So the purpose of the arthroplasty is allow people to get pain relief and a return of function, getting back to activities that they want to do in their daily lives, such as pickleball, golf, racquetball, but being able to get around and ambulate in hopefully a pain-free environment. I would recommend arthroplasty to a patient that has activity-limiting pain in their joint that's really stopping them from doing what they want to do in their everyday lives. Certainly, we want to make sure we've explored all non-surgical options before we consider further discussions of it. But once the decision has been made to proceed with an arthroplasty, the patient can expect to have surgery, and some patients, if they're candidates, will go home that day, whereas some patients will stay the night and we'll make sure they're safe and progressing with therapy before we discharge them to home. Most patients that undergo arthroplasty are in formal regimented physical therapy for about 6 to 8 weeks after the procedure. And then we transition to a home exercise program to continue to emphasize the gains that they've made with their physical therapy in the first 6 to 8 weeks. The full recovery process for a joint replacement generally is about a year, but around 3 to 4 months out is when most people are getting back to doing what they want to do, activity-wise. Something I often get asked with utilizing robotics and being a robotics specialist, is the robot actually doing the surgery or is the surgeon doing the surgery? Within orthopedics, robotic technology has, I think, given us a lot more information when we're doing joint replacements to hopefully deliver the best product for each patient individually. Utilizing robotics helps us quantifiably analyze each patient's anatomy and place the implants in a predictable place to hopefully generate the best outcome for them we can. With recovery after a total joint replacement, I think one of the most important things is the planning beforehand. Afterwards, you will be discharged to home, but you will need family support around for at least the first week, if not the first 2 weeks, to help you with some of the activities that you might be needing to do, such as showering, going up and down stairs, navigating to physical therapy appointments. So making sure there's a good coordinated plan in place before surgery helps set us up for success after the surgery. I would say to patients that are experiencing joint pains that are stopping them from doing what they want to do, they're not going on walks with their family members, they're not going to watch their grandson's baseball game. If you're experiencing symptoms like that, certainly talk to your physician about that. I think it's always worthy of a discussion, and at a minimum, getting information and discussing both the surgical and the non-surgical options that can be explored to try to get people more function, more pain relief in their joints, and hopefully a better quality of life.